When we're talking about calcium channel blockers, or CCBs for short, we're mostly talking about drugs which end in dipine. But there are two other drugs in this class called diltiazem and verapamil, which are a bit different, so we'll leave these for another video. CCBs are great at lowering the blood pressure, and they're generally pretty well tolerated. But there's a few things we need to tell patients about to prevent problems further down the line. So let's take a look. This class has a fairly simple effect in the body, relaxing the blood vessels to bring down the blood pressure. And this relaxation effect helps with conditions like angina and Raynaud's by improving blood flow to different tissues. Their quick onset of action makes them very useful if we need to control the blood pressure fast. And this is why the first thing we give someone in A&E with high blood pressure is 5 milligrams of amlodipine. And if it's still high after that, the second thing we give is another 5 milligrams of amlodipine. You don't need any blood tests after starting a CCB, so they're great for people who are anxious about needles. But as with any BP lowering drug, the body starts to work against the drug after a little while, so I generally allow 2 to 4 weeks of stabilizing before we check the blood pressure again. Most countries choose amlodipine as their first line CCB. This is because it produces a pretty reliable BP lowering effect across the population. Its onset of action isn't too quick, which can cause reflex tachycardia, and it's the least likely CCB to worsen heart failure. Your second line option in the UK at the moment is lercanidipine. This tends to be a bit milder in terms of BP lowering effect, but this also tends to be a bit better tolerated if someone gets side effects with amlodipine. This is because most of the side effects with CCBs are dose dependent, and this is the top 3 I tend to look out for. Lightheadedness can be a sign that someone's more sensitive to the effects of the CCB, so usually reducing the dose or trying an alternative gets around this. Second, ankle swelling can happen because the relaxed blood vessels carry a bigger volume of fluid to the limbs, and this can overload the very small blood vessels and capillaries, causing fluid to leak out. The third is very often missed, so it's really important to tell patients about it, but this is gum overgrowth. There's a lot of potential mechanisms for this, but the end result is gums can become thicker and difficult to clean. This is worsened if someone's oral hygiene isn't the best, and if it progresses undetected, it can even lead to tooth loss. This can be tricky to approach with patients, so I tend to say there's a chance that this treatment can cause some thickening of your gums, and this can make them more difficult to clean. If you start to notice any changes to your gums, particularly any bleeding or pain, let us or your dentist know, and we can explore things further and perhaps try a lower dose or an alternative drug. These drugs tend to be pretty good from a drug interaction point of view, but as always, be careful with HIV meds, as some drugs like ritonavir can double amlodipine exposure. There are some interactions with chemotherapy in both directions, so always tell the oncology team if you're starting these drugs for anyone going through active chemo treatment. There's an interesting interaction here with grapefruit, as this can increase the activity of some CCBs. In a lab, grapefruit slows down the CYP3A4 enzyme, but in the body this isn't actually what happens, and the interactions with grapefruit mostly happen by increasing CCB absorption. This comes up on the warning labels for most CCBs, but the main one that's affected is phenolidipine. Eating whole grapefruit or even modest amounts of grapefruit juice can lead to a 3-fold increase in exposure. So get these people to have a nicer tasting drink instead. See you next time.